why would you go to someone who's not an expert? At the end of the day, it's education, knowing that, the surgeon you pick does good work, safe work, and gets you home safely with your family. We want surgery to have, in the community, a good name, not to be scary, to be natural, and, people to enjoy it.
I am here with Dr. Ron Stark of Philadelphia, longtime client, even better friend.
Yes.
And we are really excited to be podcasting together.
Always fun with you, Erica.
Always fun. Gosh, I have so many things I could ask you right now. But I want to start off just right off the bat with something that a lot of my clients don't like, but it's just a fact, okay? So with the way that social media is today, and with the way that AI is, right? There is a lot of talk about specializing in procedures. As in, you want a rhinoplasty, you go to a rhinoplasty specialist. You want a facelift, you go to a facial plastic surgeon. If you want a breast or body work, you go to a breast and body plastic surgeon. A lot of people hate that term, breast and body plastic surgeon, because that doesn't exist. There's facial ENTs, and then there's plastic surgeons. But whether we like it or not, in the realm of social media and in AI, for the record, ChatGPT, Grok, Gemini, Claude, we are in the world of specialization, meaning you type in something on ChatGPT of who are the best, I did this the other day. I said, who are the best plastic surgeons in Miami? Because we're running a test. And then it said, what do you mean plastic surgeons? There are people who specialize in breast and body work, and there's people who are good at face. And it separated out answers to me of facial plastics and then people who are well known for their breast and body work.
So why is AI being educated in that way?
I think that because there's enough on the internet that has pushed it that way, there's enough on social media that's pushed it that way, enough blogs, and I have a lot of wonderful facial plastic surgeons that I work with.
And I think they're great. I think some of their work is probably one of the best facelifts in the world.
Absolutely.
I just think, a lot, we need to educate people. What is a plastic surgeon and what is a facial plastic surgeon?
Mm-hmm.
I mean, we all come from totally different pedigrees. We're trained differently. Plastic surgeons can be trained in general surgery or go straight to plastic surgery.
Correct.
They come from oral maxillofacial surgery.
Mm-hmm.
I mean, I even have colleagues that were ENT surgeons that have come into plastic surgery. So I think a little bit of education, because our pedigrees, we're trained, I always tell patients, from the hair to the toe.
Yes.
And facial plastic surgeons are trained from the neck up. So there's obviously a differentiator, and I understand AI is going there, but it's maybe AI can also educate itself and understand what's the difference. But we can go back to specialization.
Right. So it's a tough thing because there's what's correct, right? And then there's what's marketed, right?
Okay.
And unfortunately, those things aren't the same, right? We've both seen, I'm not going to name any specifics. We've both seen, let's just say, well, I'm sure somebody's going to pop in your head, somebody's going to pop in my head. A plastic surgeon who's really famous on social, who we know who has terrible belly buttons, right?
Right.
Bad tummy tucks, but they're huge on social, booked out for years. Like, these people do exist, right? And marketing is interesting that way. And it's funny, I'm talking about it, it's my own field, but there is a factor of it, which is there's how good is the plastic surgeon, there's how good is the plastic surgeon marketed, right?
So it's all about marketing. It's not really about how good the plastic surgeon is.
I hate to say that. I think that they go hand in hand, because at the end of the day, I do think that people make their final decision based on before and after photos.
Right.
So I would not say it's mutually exclusive, because I think the decision comes at the point of a before and after photo. So
I think it's interesting because it's way easier to put breast and body photos.
Yes, than face.
Because the face is hidden, and that is one of our hardest things to do on faces, because in a high level boutique practice like I have at Stark MD Plastic Surgery, that's a challenge for us to put patients' faces. And we're always glad to show patients the faces in the office, because the patients have given us, the right to do that, but not on social media, not on TikTok, not on even our website. But, I think there is something, you must specialize in something. And if that's what you want to be known for, then I agree with you, And, we brought in another plastic surgeon into the group, and she specializes, both in face and breast, but she really wants to, focus on her face. She does a wonderful facelift, and we're
Mhm.
going to focus the practice, mostly for her for face
Yeah.
and for me, breast and body, but we will meet a little bit at
In
the
the middle.
breast and the face, because I still would like to do faces, but
Yeah, and I love that you said that. And the truth is, I've seen your facelifts. You do a great facelift.
thank you.
But
It's a secret.
it's a secret.
It's a
It's a
gem. No
secret.
one realizes that.
But I appreciate you saying that because I do think ultimately that is the move as not just a plastic surgeon, but as a business owner.
Right.
You mean your second surgeon that you bring in, if you are predominantly breast and body, if it's a very smart move to bring in somebody who is predominantly face.
I think it's hard for a practice suddenly to shift focus.
Right.
But we've always talking about this, and I think we've been talking about it for the last 3 to 5 years
Mm-hmm.
since we've talked. And I think it's not the wrong thing to do in
Well,
a practice.
We've worked with you for a long time, but in examples, we've worked with Dr. Mike Nyack for a very long time, right? Obviously, he's a facial plastic surgeon, incredible facelifts, but he brought in a plastic surgeon, breast and body focus, which is
Right.
a huge boost in type of patient you can never really service
But
before.
yeah, don't you think it's going to cause a little bit of these facial plastic surgeons are hiring plastic surgeons, the plastic surgeons are hiring facial plastic surgeons. We're all kind of crossing fields. Even the dermatologist, it's like, why aren't people just staying in their lanes and respecting the other practice? Do you know what I mean? It's starting to start a little bit of a, hey, I'm going to be a plastic surgeon now because I'm just going to hire a plastic surgeon into my office.
Sure, I hear what you're saying.
There's a lot.
I think specifically for facial plastic surgeons, ENTs, right? Did facial plastic surgery fellowship or the whole 9 yards, right? And for plastic surgeons, I think that the merger is beautiful.
Yeah.
Now, I would argue, and there's this word core that goes around. I would argue that the facial plastics are in that definition of core. But if we're talking about other type of doctors doing surgery, I don't want anything to do with that. You know what I mean?
Wow. Well, that's a big problem, that people should talk about. I recently heard of a dermatologist doing brow lifts and a facelift.
Yeah.
But,
terrifying.
he's pretty well known apparently.
Mm-hmm.
And one of my colleagues told me that they lost a patient to him.
I believe it.
And why would you go to someone who's not an expert? At the end of the day, it's education, knowing that, the surgeon you pick does good work, safe work, and gets you home safely with your family, because and without any complications, because we want surgery to have, in the community, a good name,
Mm-hmm.
not to be scary, to be natural, and, people to enjoy it. This is this is elective surgery. This is not emergent surgery,
No.
so I think also people need to stay in their lane. So
I
absolutely.
agree. So I think that anything that's the amount of training it takes to be a plastic surgeon and even a facial plastic surgeon, it's pretty extensive,
Yes.
right? It just that is not the same for an ER doctor or a dermatologist. I'm just sorry, they're not trained to do
I mean,
surgery.
on average,
like
you know
that.
how long it takes to become a plastic surgeon?
12 years.
I mean, it could either be, you want to include med school,
I'm
that's
adding-
4 years.
yes.
Either you go to a specific plastic surgery residency, which is 6 years, so that's 10 years. Or if you do 4 years plus 5 years, that's 9 years, plus another 3 years, that's 12 years. So anywhere from, 10 to 12 years, plus we do another aesthetic fellowship.
So I would say, I
You know,
feel like
so
the fellowships,
13
everybody's on that 12 plus.
Right. So we're
Very
all like
serious
around
ones.
12, 13 years of training.
Mm-hmm.
So patients need to know, when you go to a board certified plastic surgeon by the American Board of Plastic Surgery, this is someone who's been vetted. They've done all the rigors they had to do. And, you're going to an office and you should feel good about it, that
I
you're in
agree.
good hands, because our board, we constantly look at these things. We make sure that everyone stays up to date and they're ethical and they're doing good work. And if there was a problem, someone would step in.
Absolutely. And I will say that is a plus of AI. AI always, 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 and almost any response you get mentions board certification.
That's good.
So they might be specializing you, which, you could take it or leave it, just a fact, right? But they are absolutely mentioning board certifications. And it will actually go out of its way to mention that somebody is not a board certified plastic
Well, that's great.
surgeon.
That's great.
And
to
I do
hear.
think that is a plus, and I think that there's going to bring a lot more awareness around it, because the way that AI is crawling different things, it absolutely crawls the board certification website. So if you have a double board certification or a triple board certification, it's also going to say that,
Right.
right? So
What about knowing what boards are officially, there's some boards that are not recognized by the American Board of Medical Subspecialty.
From my experience, from my own searches and checking and seeing what clients show up where, it absolutely has the correct boards in there.
Okay.
Meaning it is actually pretty accurate. It's not like, oh, it's board certified by the American Association of Cosmetic Doctors. It's not saying that. It's not saying that. It is saying, I've seen it go like, oh, okay, this person is, a dermatologist, and like it specifically will say it. So I think that's a plus of AI, is that I think being board certified it's going to be stressed even more and more as time goes. But I think the specialization is it's just a fact. And I think you did it right. Like I said, you do a beautiful facelift, but I think by bringing on Dr. Campbell, you have both tackled.
No, we're excited about that. She brings a very elegant touch, great results, natural. I think it's exactly what patients want in the Philadelphia and the entire country.
Yeah, I think
she has patients from all over, just like I've started. I mean, just in the past week, I operated on someone from New Orleans, Denver, and believe it or not, Chicago. That's pretty impressive.
I believe it.
It's not just a local market anymore. It's the whole country.
I mean, I told one of my staff, any person she wants, she could get her mommy makeover, and she flew from Florida to Philly to you.
I know. And she's around here.
She looks
amazing.
Here. It looks amazing.
And she runs like marathons.
I know. She's doing fantastic. And we both know that after I have my second child, I am coming to you.
Well, we have that on video now.
Yeah, we do. It's okay.
Right.
It's okay. That's how
now the whole world is going to look at me.
The whole world's going to know.
All right.
Because you know what? I know you're going to give me a good belly button, and I've been in this industry long enough to see a good tummy tuck belly button. And don't get me wrong, I have plenty of great clients that do tummy tuck. We've worked together for quite some time, pretty much since the beginning here. So, but no, you do great tummy tuck, but really great belly button's hard to see, unfortunately, in a tummy tuck. Let's just call spade a spade.
Yeah, it's the last thing we do in the tummy tuck. So everyone's already tired. And I always tell my room, like, relax. I got, still work to do.
Yeah. Speaking of which, I know we're kind of keeping these things short, but you've done so well in such a short amount of time. It's crazy. You're on your second provider. How long has your practice been open now? It's not that long.
My official practice since 2019. So 7 years.
7 years.
Now, we opened a surgery center the past year. We have 4 nurse injectors, 3 estheticians. And, we're just looking forward for the future and keep growing.
Yeah.
I mean, I even spoke to Dr. Campbell. It's not the last surgeon I'm bringing on.
Nope.
And, we're looking forward.
Well, that is very impressive. It's a very impressive level of growth.
Well, Influx has helped as well.
I like think just a little bit. A little
bit, a lot. But
it's good. And you're an expensive practice too, which is something I prefer my clients to be.
And you love talking about prices.
I always love talking about prices. I don't like cheap prices. It's
I mean, cheap is not, always the best, right? You want a Bentley, you don't go buy a Ford,
correct.
Right?
And I would say that this is a luxury area, right? Aesthetics is a luxury service. And I get that's not entirely true. Somebody will save up for a breast aug. Somebody will save up for a rhinoplasty, and that does happen.
Well, it's always interesting because, you go to, a less expensive place, you don't get a good breast aug.
Yeah.
It might look good, but there's no longevity to it.
Correct.
And then they'll come into practice and want a revision.
Yes.
And then
which is a lot more expensive.
And then they don't understand.
Right.
And then, you start having these talks, but it's the same thing. So then they try to go to a less expensive place. And now they come in with a revision, which is not good, with more issues.
Correct.
And I wish patients, one of the things we have to do is educate.
Yes.
And patients really need to understand that.
It's so true. And people don't always realize, but sometimes you see a person, you're like, oof, their work doesn't look good, right?
Yeah.
And sometimes it's just bad work, bad surgeon, or maybe they gave bad direction. Sometimes it's not about the surgeon. Sometimes they want it to look that way, and you gotta let that just roll.
But just because you can,
doesn't mean you should.
And then as a surgeon, you should just say no.
I know.
It's something that some of our mentors have taught us, but just in the past year or two, I've now said no to patients because I want the results to look good, and if you're not going to agree on it, then it's not always the right thing. And we're not meant to be a match.
Exactly. But I would say that also some of the quote unquote bad work that you've seen is actually something that has had to be revised too many times.
Yes.
Because there's a certain point when you run out of fat, you run out of tissue, you run out of skin, and you are working with it the best you can. But if somebody's coming to you and you're their third revision because they went cheap the first 2 times, you're going to do the best you can. But
Yeah.
You're in a tough situation.
Right.
And you've seen that. You've seen somebody on their third or fourth facelift. You've seen, and there's a point when it goes, okay.
Oh, yeah.
Sometimes it's fine if they did it right from the beginning, but sometimes it's not fine. So it really goes into it's worth spending the money on it. But also most patients at this point, there's so much education around it that it is.
Well, AI is helping that.
AI
right?
is helping. Like I said, there's pros and there's cons,
I mean,
right?
yeah.
But their pro is helping with the education that people understand they need to spend money for good plastic surgery. So there's
Absolutely.
no reason to have low prices. Even if, Block cosmetic ER doctor down the street
I know.
is doing a cheaper facelift than you.
Happens all the
It
time.
happens. Doesn't matter.
Yes.
Well,
So
Dr. Stark, it's been great having you on. It's
Thank you.
always a pleasure. And yeah, we have the next few days to hang out here at the aesthetic meet.
yeah, it's gonna be great. There's so much good stuff here. So
Yeah.
let's go.
All right.
All right.